Sepsis symptoms: understanding the life-threatening overreaction of the body. Sepsis is a severe medical condition in which the body's response to an infection becomes overactive and extreme, posing a life-threatening emergency. Without prompt treatment, sepsis can lead to tissue damage, organ failure, and even death. This video aims to provide a deep understanding of sepsis symptoms, its causes, risk factors, diagnosis, treatment, and prevention strategies. Introduction to sepsis. Sepsis occurs when an infection that you already have triggers a chain reaction throughout your body. Although bacterial infections are the most common cause, other types of infections can also lead to sepsis. These infections often originate in the lungs, stomach, kidneys, or bladder. Surprisingly, sepsis can begin with a small cut that gets infected or with an infection that develops after surgery. In some cases, sepsis can occur even when individuals are unaware of having an infection.
Understanding the severity of sepsis. Sepsis poses a significant threat to health due to its potential to cause extensive damage. It is crucial to be aware of the symptoms and seek immediate medical care if sepsis is suspected. Common symptoms of sepsis include rapid breathing and heart rate, shortness of breath, confusion or disorientation, extreme pain or discomfort, and fever with shivering or feeling very cold. Clammy or sweaty skin is also observed in sepsis cases. Causes of sepsis. Bacterial infections are the leading cause of sepsis, but other types of infections can also trigger this condition. The video explores the different sources of infections and highlights the need for vigilance. By understanding the causes, individuals can take necessary precautions to minimize the risk of sepsis. Risk factors for developing sepsis. Certain individuals are more susceptible to sepsis due to various risk factors. Adults aged 65 or older, people with chronic conditions such as diabetes, lung disease, cancer, and kidney disease, as well as those with weakened immune systems, pregnant women, and children younger than 1 year old are at higher risk. The video delves into these risk factors and emphasizes the importance of early detection and intervention. Recognizing the symptoms of sepsis. Sepsis manifests through a range of symptoms that should not be overlooked. From increased heart and respiratory rates to confusion and extreme pain, recognizing the signs is crucial for timely medical intervention. By detailing the symptoms associated with sepsis, the video aims to raise awareness and encourage prompt action. Seeking immediate medical care. Prompt medical care is essential when sepsis is suspected. The video emphasizes the urgency of seeking help when symptoms arise or when an infection does not improve or worsens. It explores the diagnostic tools and methods used by healthcare providers to confirm sepsis and determine the location of the infection. Challenges in diagnosing sepsis. Diagnosing sepsis in its early stages can be challenging due to overlapping symptoms with other medical conditions. The video sheds light on these challenges, ensuring readers understand the importance of vigilance and seeking medical care even when the diagnosis is uncertain. Prompt treatment for sepsis. The timely administration of treatment is crucial in managing sepsis effectively. Antibiotics play a vital role in fighting the infection, while maintaining adequate blood flow to organs is essential. The video delves into the treatment strategies for sepsis, including infection management, blood pressure stabilization, and advanced interventions for severe cases. Surgical interventions for sepsis. In some serious cases of sepsis, surgical interventions may be necessary to remove tissue damaged by the infection. This section explains the role of surgery in managing sepsis and highlights the importance of a multidisciplinary approach to treatment. Prevention strategies for sepsis. Preventing sepsis begins with taking steps to prevent infections in the first place. The video offers practical tips for infection prevention, emphasizes the importance of managing chronic health conditions, and promotes recommended vaccines. It also highlights the significance of good hygiene practices and proper wound care to reduce the risk of developing sepsis. Conclusion. Sepsis is a life-threatening condition that demands immediate medical attention. Recognizing the symptoms, understanding the causes and risk factors, and seeking prompt treatment can make a significant difference in patient outcomes. By practicing infection prevention strategies and maintaining good overall health, individuals can take proactive steps to reduce the risk of sepsis. FAQs. 1. Can sepsis occur without any noticeable symptoms of infection? Yes, sepsis can develop even in individuals who are unaware of having an infection. It is crucial to be aware of the general symptoms of sepsis and seek medical care if they arise. 2. Are all bacterial infections capable of causing sepsis? While bacterial infections are the most common cause of sepsis, other types of infections can also lead to this condition. It is important to be vigilant and seek appropriate medical care for any infection that does not improve or worsens. 3. How can I prevent sepsis? Preventing sepsis involves practicing good hygiene, taking care of chronic health conditions, getting recommended vaccines, and ensuring proper wound care. By following these preventive measures, you can reduce the risk of developing sepsis. 4. Can sepsis be diagnosed early? Diagnosing sepsis in its early stages can be challenging due to overlapping symptoms with other medical conditions. However, seeking immediate medical care when symptoms arise increases the chances of early detection and intervention. 5. What should I do if I suspect I have sepsis? If you suspect you have sepsis or if your infection is not improving or is getting worse, it is crucial to seek medical care right away. Sepsis is a medical emergency, and timely treatment is essential for a favorable outcome.